All right, so now I wanted to show you what it actually looks like in the student's view. So they're on this side, they're able to scroll down. If they scroll down to the bottom, they can get some information on their instructor. And then all of the individual courses, in order of course, only logically, are here. And the student must progress in order. I have admin capabilities so I can jump around, but this is basically the same view that the student would have. It would have their own login up here, and they wouldn't have that admin capability. So if we look at these days, we'll jump into something fun like drug review. So drug review is day 3, and when we jump in there, you can still see what's next, what's tomorrow, what's yesterday over here. It'll show you what you're working on. And of course, the student wouldn't be able to get to day 3 without completing days 1 and 2. Each day has a study guide here at the beginning or the foundational courses. We have a lot of the information pre-printed, especially since it's drugs, dosages, spelling's an issue, and as is units. So we have pre-printed a lot, but there's still a place for the student to take notes. So these are to be printed and used as note-taking and study guides. When we move into the next sections, it is much, much more that the student is taking all of the notes, and these are a little bit less. I'm gonna go ahead and play a video, and then we'll just jump in and see what the videos look like. So we're just going over all the drugs, sorry. So we're just going over all this information. Of course, this is information they've gotten in respiratory school, but we all know that medications is not something that everybody does well in. And then in order to move forward through each of these days, they have to watch the video in its entirety, and they're able to backtrack and slide along this bar. They can't go fast forward like I'm doing, but they can go back and say, hey, what did she say? I didn't quite understand it, and go back. And then they go through the quiz, and the quiz is very easy. It's all on the same screen. They can't get lost, and they can't move forward without going through the process. And so they would have to click on which one's a diluent, and they would check, and they would say they were correct, and then continue. You have to get a 70% to move forward. All right, so then we'll jump to another day. So this is a long one. This is 47 minutes because it's hemodynamics, right? And here under hemodynamics, we have a lot of information. And again, we are filling in some of this for them, and some of it is for them to fill in themselves because it's at the beginning. And so we have the hemodynamics lecture, and we teach them to draw their own little heart and lung system. Yeah, and so we're just going to go over all of this. And then again, there's 14 questions in this section. So we always say there's at least 300 questions in our program, but there's really more. I just didn't take the time to add up some of these sections that have more than 10. It's 30 days, minimum of 10. That's why I say over. This one happens to be 4 over, just because it was so important to make sure they understood the hemodynamics. Math is our last section in our, let's see, what do we entitle it? We entitled it Ultimate Review. So this is basically all the things, or the foundations, so to speak. And then we have some calculations on there. And then there's lots of space for them to fill in their own equations and do things like that. Okay, so math is also 40 minutes. And there's lots of information in here. Talking a lot about all the different calculations and what they mean, in addition to just knowing how to do them and when you need to use which ones to get you the right answer on the TMC. And so, yeah, all the way from basics, beginning of respiratory school calculations, through the bank calculations. And then that's just our feedback form. And I'm going to jump in here into the disease section. Now, the next 13 days are diseases and disorders that you will find on the TMC. And this is also foundational for the CSE. Those that take our CSE only, we actually give them the vast majority of this disease section as a background basics, because we don't find them very successful when they don't have it, because they really need this background. They need to understand the diseases backwards, forwards, and sideways. And the way we do this is, now look how blank our study guide is now. They need to differentiate. It's all about comparing and contrasting, which is, as you all teachers know, is true learning. If you can compare it to something, contrast it with something, you actually know it. So it's vital that they understand the diseases as a comparing it and contrasting it, and what does it all mean? What does the acid base look like in that condition? What is it, an acute or chronic? Is it a resistance or a compliance issue? And then we go on here to our equipment, oxygen recommendations, medication recommendations. There's a couple that we will mention, like under other considerations, we would mention the microbiology of it all, as far as isolation, because this is things that they would be on the TMC, cleaning equipment, disinfection, that sort of thing. So all of these are filled out. I mean, not everything, like an acute disorder like ARDS isn't going to have a lot of education, but a chronic disorder like COPD certainly is. So that's what this is all about. Then we have a study guide and our video, and then we also have digital flashcards. So these, you just play them and they will come up. And so this is a lot of the information they need for that study guide they can get from this, in addition to the flashcards. So sorry, the music's going to come on. Some of them have music, some of them don't. So this is how they get their flashcards. They just kind of watch the video, and they can watch it as much as they want, and you could always pause it, like I just did, and you'll just have your vitals there. Okay, I'm going to repause it. Sorry. So once we're into the diseases, we need to make sure that they understand these diseases backwards, forwards, and sideways. If they just get a little bit of information in a scenario and maybe a PFT or a blood gas or an EKG, that they understand what's going on. So there are a lot of diseases and disorders, and they vary by length. You know, here we have neuromuscular disorders. That's only 16 minutes long, because we're just concentrating on the big two. I think we do include ALS in that, in addition to Guillain-Barré, myasthenia gravis, but it's not that complex. ARDS is actually only 28 minutes, and then we have the longer ones as necessary, the ones like post-op disorders that will have more than one disease or disorder in it. That includes pneumonia, post-op atelectasis, the whole 9 yards. So, and then in addition to all of those days, we have these case studies. And case studies are just really getting them used to using the skills that we're having them do by taking the notes on our disease sheet and being able to figure out what the disease is. So here we're going to give them a scenario. This includes an x-ray, includes an ABG, and I don't think there's labs on this one, and some of them do, and this one has some ventilator information. What they're going to do with that is they are going to fill out the case study PDF here. Sorry, it's taking a second to open. This is for them to download. Okay, so this is what I meant. They have the case study assignment is very, very similar to what they've been taking notes on, except for here, they're writing it down and then they're trying to figure out what it is. So at this point, they have to guess what disease it is. And then diagnostic test, what's going to prove that, talk a little bit more about the history, and then give the problem lists and how you would treat the problem. This is So important and so vital for that critical thinking, so that when they get that question, they know what they're able to easily identify that disease process and know how to treat it. And then this is a great foundation for the CSE. The students that take the TMC and do all of this work find it much easier to go through the CSE program and really ace the CSE on the first try. And their decision-making scores are very good, and their information gathering scores are phenomenal because they're used to thinking like this. So that is how that works. Now we have something, we have some really long ones, like for instance, neonatal management. Neonatal is bigger on the TMC and CSE than it has been in the past. Pediatrics is actually still around, but there's just a lot of neonatal information. Not only do we have to cover the ventilator, what to do on the vent with different things in neonatal, because we don't cover that in mechanical ventilation. We only cover it here. We also have to cover all the diseases and disorders. So this is a 4-page study guide. It has a huge amount of information on it. And this is one of those study guides that we put a lot of information in addition to them taking notes. And then we have our lecture, which is very long, but it has to cover everything from our LS ratios to our maternal factors to our surfactants and determining gestational age. Everything is on here. And then it really is helpful because we do go over Ballards and Silvermans. Even if they don't remember it, they know what it is, so they're not grasping at straws on the CSE for information gathering because they were reminded. All right, and then we move into that final section, which is putting it all together, but what it basically is mechanical ventilation with a couple of extra things in it. So we have initiating, adjusting, troubleshooting. Okay, let me stop this one so we can. I can't remember which. Sorry, I'm trying to figure out which one of these is going. Here it is. It's this one. So this one has a little bit of information. So we're going over previous test answers. We're really talking about it with the students. In addition, there's a study guide about adjusting mechanical ventilation. This one has some optimal PEEP stuff on it. And then the video goes into everything. And we include MPPV and mechanical ventilation in each of these sections. The trend is going further and further away from conventional ventilator on the TMC and the CSE. We started with ventilator liberation, something we really want to get them off the ventilator. And instead of just weaning, it's like more and more of a priority, and it's just continuing in that method. And because of that, we are concentrating a lot on MPPV, making sure they know how to adjust both the MPV and, of course, the traditional volume and pressure. Another thing I noticed when I was really reviewing the matrix for 2020 is a lot more of the questions I think are going to be involving spontaneous modes, or at least spontaneous breaths on an SIMB type mode. So it's something we really want to make sure they're understanding. So we have all of these, and then there's the final 2 case studies, case study 5 and case study 6. And then the final day 30 is just kind of tips and tricks to get them ready for the TMC. All right, I didn't want it to be quite this long, so I'm going to stop here. But for spending this time looking at the program with us, thank you.